Hi there. There was a slight miscommunication between me and CityMatCH. I was slotted into a poster session but had a talk that was accepted for the conference. So hopefully this first slide lets you know that the reason that this is a 20-minute recording is that it's not just a poster. This is a PowerPoint. But you know what they say, a PowerPoint is just a poster broken into slides. The title of our talk today is Like Mother, Like Baby, and we examine the question, will under-immunized mothers raise under-immunized infants? And we will examine this question using data from the 2016 through 2020 Michigan PRAMS Survey. My name is Pete Hake. I have the pleasure of speaking and sharing these findings with you. However, this represents the contribution of a number of people, including Mackenzie Mental, Hannah Sauter, Jill Hardy, Susanna Joy, Chris Fussman from the Michigan Department of Health and Human Services, and one from the Michigan Public Health Institute. You'll see this slide a number of times. This is our outline for today. We will start with a little bit of background on the importance of maternal perinatal immunizations, and we'll examine our research questions, the methods we're going to use, some of our results, and just think about those results for a bit. The thing that will change each time you see this slide is over here. In addition to looking at population level information from Michigan mothers who chose to comment on influenza or vaccination, we'll look at some individual level responses and individual level comments to complement the population level look that we're taking. Thank you, Michigan PRAMS respondent. I agree with you. It is fitting that we are looking at maternal pregnancy immunizations together in the month of December because the first one that we will look at on this slide is seasonal influenza. And pregnant women have a special or increased vulnerability to negative impacts from routine influenza infection, as do their infants. And this is why medical science recommends that women get a flu vaccine either 3 months before or during their pregnancy, and such vaccination to mom offers protection from her own hospitalization and also influenza infection in her or in her infant. And then the second one that's of special importance in this time frame is whooping cough or pertussis, and it's a real danger for infant mortality and certainly infant morbidity, and hearing those tiny coughs will just haunt your dreams. So preventing that sort of discomfort and potential death for an infant is important. And starting in 2012, to protect against pertussis in the infant, medical science has recommended a Tdap vaccination during pregnancy, and that protects against three different agents. And the vaccines have been shown to be effective. It took a couple years to come up with the hard numbers, but it can reduce the risk of maternal pertussis infection by almost 80% and 90% for infants. So in and of themselves, these are two very important maternal perinatal immunizations, and we're going to see if we can find a larger research question to look at with these two, and we will do so in this next section. But first, here is another individual level comment from a PRAMS respondent. This tricky little baby decided to come early. Mom had been planning the shot in late pregnancy, and baby showed up just a little bit too soon. The research question that we will ponder together today is, here's our independent variable or our exposure variable. We're going to look at how many mothers report that they received either of these two important pregnancy immunizations. And we are going to look at an outcome variable or a dependent variable, and that is how many mothers plan for their infants to receive all of the immunizations that their doctor recommends. And we will explore together, is there a relationship between maternal immunizations around the time of pregnancy and future plans for infant immunization? We move on now to the brief methods section of this talk. We'll talk for one slide about the PRAMS survey, and then I'll let you know what statistical tests were being performed. But here's another individual level comment. This mother's pediatrician recommended a flu shot for her a few weeks ago, and this is in the postpartum period when people answer PRAMS. She did not get one during pregnancy, but the benefits of the flu shot could be passed through breast milk. So there's still a window in the post-pregnancy period to provide protection to the infant, and that's good news. The data source that we're using to ask these research questions is the Michigan Pregnancy Risk Assessment Monitoring System, PRAMS for short. And PRAMS is an annual ongoing survey. Every year we randomly select, often between 2,800 or 3,600, depending on the year and our goals, mothers to participate in the survey, and then we work our butts off to get as many of them to answer the survey as we can. Typically between 50 and 60% of those selected end up completing PRAMS. And the PRAMS survey does not randomly select everybody with equal probability. We choose to design the survey such that we oversample, we have greater representation, louder voices, if you will, better detailed information on the experiences of mothers who had a low birth weight infant. We, as a state, are committed to doing everything we can to improve the equity of birth outcomes. Therefore, we oversample Black mothers. We want to know what's going well. We want to know what's not going well around the time of pregnancy for them. And then we oversample Southeast Michigan, those little counties over in orange, not because it's more important than the rest of the state, but rather it provides a clear picture for the state as a whole when we do this. And those who are sampled for the survey often complete it between 3 and 7 months postpartum. And importantly, thanks to the way that we sample and the way that we conduct the survey, it's a population-based survey. In other words, those who complete the survey, their results, the things that they share, mean that they're not speaking just for themselves, but rather the results are weighted so that they end up representing, with a degree of statistical certainty, the experiences of all mothers of live births in the state in a given year, which is often very close to, but never quite exactly equal to, the number of babies born in a year. But here we go. That's PRAMS. And then just a little bit about inclusion and exclusion criteria in terms of which respondents make it into this analysis. In the typical full Michigan PRAMS data set, across these years, we'll be looking at 5 years of data, 2016 through 20. And that's the completed surveys for 8,351 respondents. However, like I said, these are weighted thanks to the methodology so that each respondent is speaking for, I don't know, just a little under 100 respondents, kind of like her. And this is the weighted count for this data set. And the full data set is the one that we use every day to provide population level descriptive statistics. However, for the purpose of doing this research question and doing some modeling, we narrow the data set down just a smidge. We exclude a few respondents, those whose infant has died. We don't ask them about their plans for future immunizations. The same with those who say that their baby is not living with them at the time that they take the survey. And so that leaves us with 8,213 respondents, and then we head into the modeling process, and those who make it into the final model are those who have a completed survey answer for each individual element in the model. So that ends up cutting down a bit more on the numbers, and so we're conscious of that, but that's the reality for any sort of modeling question. So briefly, a few statistical tests that will be used, and the defining characteristic of all of these tests is that they work with weighted survey data. That's not every tool can be used within this context. So the population proportions and confidence intervals that you'll see are generated using this. We perform weighted walled chi-squared tests to determine which things are significantly associated with our exposure and our outcome, and which things need to be tested in the model. And then the model itself is run using weighted log binomial regression analysis using the SAS survey procedure GenMod. actually it's not a survey procedure, just SAS Proc GenMod, but it can accommodate analytic weights, and it also allows us to output risk ratios, which are much more interpretable than odds ratios. The table has been set. Now it's time to move on to our meal. We'll look at some results. And one more comment. This respondent says that she wishes that vaccinations would be discussed sooner and with a little bit less pressure. So our independent variable will be comprised of the two maternal perinatal immunizations. The first one is asked using this question during the 12 months before your baby was delivered. Did you get a flu shot? Either of these yeses, before or during pregnancy, means that mom and baby are both protected. And so starting with no, 45% of Michigan mothers say they were not immunized for the seasonal influenza during their pregnancy. And then combining, that leaves 54.7% who were protected. And that's comprised of 10% who had the shot in the 3 months before pregnancy, and then 44.7% who had the shot during pregnancy. And then the other one is going to be Tdap. And we ask, did you have a Tdap shot during your most recent pregnancy? And about 27.8% say, no, I did not. Another 72.2% said, yes, I did. And the astute watchers know that there's a third response option, that's I don't know, and we are excluding it from this analysis, but we intend to look at it in some sensitivity analyses to see what impact the I don't knows might be having. For the sake of interpretability and for the model, we're going to combine these two maternal perinatal immunizations into a single descriptive cumulative variable. And so the different sorts of categories that one could fall into here are those who had neither vaccine during their pregnancy, and that's the top over there, 21.3%. Those who had just one vaccine, 30.4%, and they'll be referred to hereafter as the under-immunized group, the prior one being the not immunized group. And then the remaining portion is just about half of Michigan mothers who report that they had both vaccines, and we will call them immunized. And these will also be these will form the baseline group against which we compare risks. Let's look now together at our outcome variable or our dependent variable, and we ask PRAMS respondents this question: what are your plans for vaccinating your new baby? And the people can respond, my baby will be vaccinated exactly the way my doctor says. My baby will get every vaccine, but at different times. My baby will only get some of the recommended vaccines, or my baby will not get vaccines. And so these represent four different routes, four different sets of plans that women report to us in terms of their plans for infant immunization. And keep in mind that these are what mom is reporting to us as she's completing the survey, which is most often 3 to 6 months postpartum. And the numbers that go along with this is that a large majority, almost 85%, report that their baby will get all the vaccines the doctor recommends on the schedule doctor recommends. Another 5% say that their baby will get all the vaccines, but on a different schedule. 7% say that their baby will only get some vaccines, and about 3% say that their baby will get no vaccines. And so, again, to create fewer analytic groups and to make things a little bit more interpretable, I'm going to combine a few of these categories. So piling all of those up into a single column, and you'll notice that the bottom blue group is actually much larger than this, but we just squished the axis to keep everything visible. We see the four groups that we looked at on the last slide, and we're going to run two different models, and one of them will be looking for, we'll call it outcome one. Mom plans that the infant will miss either some or all of their vaccines, and so this would be an under-immunized infant, and we're looking at about 10% of Michigan moms who report that their infant will be under-immunized. That's the 3.1 plus the 7.1% there. And the second outcome that we'll look at is focusing in on a little bit higher risk group, mothers who say that their infant will receive no vaccines, those who would be categorized as not immunized, and that's about 3%, and that's represented right there. On to our first model, we're going to look at how common it is to find women who are making these plans, the 10% who say their infant will be under-immunized. How likely are we to find these plans amongst moms who are not immunized themselves, moms who have one immunization, and then moms that have both immunizations? We look first at the plain old unadjusted associations, and this is the proportion of moms who say their infant will miss some or all vaccines. And remember, overall, it's around 10% of women say that these are their plans for baby. And if we look amongst the moms who have no immunizations themselves, we see a whopping almost 30% of those in this group say that their infant will miss some or all vaccinations. And amongst those who are partially immunized, we see about 10% say that their baby will miss some or all immunizations. And amongst those who had both immunizations for themselves during pregnancy, it's exceedingly rare to find women who are planning for their infants to miss some or all vaccines. And for that reason, this lowest risk group for plans to raise an under-immunized infant, those who had both flu and Tdap coverage, that's our reference group. There we go. And the other risks will be looked at relative to this group. And so comparison one, let's compare those who say that their moms who had no vaccines versus moms that had both, this group versus this. We simply divide 29.7 by 2.4 and find that this risk of planning for an under-immunized infant is 12 times more likely amongst women who had neither pregnancy immunization for themselves. And then the second comparison is mothers who had one vaccine during pregnancy versus those who had both. Take 10.5 divided by 2.4, and we've got a fourfold increase of risk in this plan for infant immunization amongst under-immunized mothers. So across both of these, we can definitely state that the risk for plans to raise an under-immunized infant is significantly higher amongst mothers who missed one or especially both of their recommended perinatal vaccines. And we know that there could be other things responsible for this. Therefore, let's run a model. And run a model they did. And we found that the sorts of things that were kept in the model were whether or not mom was likely eligible for federal services, need-based services, education category, race, ethnicity, pregnancy insurance, parity, marital status. Things that did not make the cut include maternal age and smoking during pregnancy. And so you'll recall that we had a 12-fold risk without accounting for these factors of risks that women were planning to raise an under-immunized infant if mom herself had received neither vaccine. And after adjustment, it's not that much different. It's decreased a little bit, but it's still a really large excess risk. And then the same is true for the second comparison, women who received some immunizations for themselves versus those that received both. And it goes from a fourfold increase to a threefold increase. So we can conclude that multivariate adjustment has little impact on this magnitude of association. Moving on to our second model, we will focus in a little more detail on those who report that they do not plan for their infant to receive any vaccines. So this 3.1% up here. And we'll see how likely we are to find these sorts of infant plans amongst mothers who themselves had both recommended immunizations, had just one, either flu or Tdap, and how common it is to find these sorts of infant plans amongst moms who had neither flu nor Tdap immunizations for themselves. So on this second research question, looking at the unadjusted associations, The risks, again, that mom plans for her baby to receive no vaccines at all is about 3% of the population. And if we look amongst moms who had neither flu nor Tdap shots for themselves, we see that about 13% say that their infant will not be immunized. If we look amongst those who had just one, we see that 1.6% say that their infants will not be immunized. And if we look amongst moms who had both flu and Tdap shots for themselves, it's super difficult to find anyone who's planning that their infant will not be vaccinated. And so once again, this lowest risk group for plans to raise an unimmunized infant, that's our baseline group for comparing the risk for these other groups. And so comparison one, comparing mothers who had neither vaccine for themselves against those who had both, right there is perhaps the largest risk ratio I will ever see in the wild. We are 48 times more likely to find plans for unimmunized infants amongst mothers who were themselves dual immunized, as opposed to those who were unimmunized. And the second comparison is still important. Amongst moms who had one shot for themselves, one vaccine, we are still about 6 times more likely to find plans to raise an unimmunized infant compared to women that were fully immunized themselves. So for sure, the risk for plans to raise a non-immunized infant is also higher, significantly higher, amongst mothers who missed one or both of their own recommended perinatal vaccines. Any conclusion of that sort needs to be accompanied by some, well, what about this? And that's this second model. And the things that made it into this model are pregnancy insurance, maternal race ethnicity, and then smoking during pregnancy. Things that did not make the cut: maternal age, federal services eligibility parity. And after trying to beat up this association and knock it down and throw some other competing causes at it and see what happens, we go from a risk ratio of 48 times the risk in one group versus another, and 47. There's hardly any change. And then the same is pretty much true for the second type of comparison. So here, as before, a multivariate adjustment has little impact on the magnitude of association when it comes to looking at risks for plans to raise a non-immunized infant amongst women with different immunization practices themselves during pregnancy. Our time together will conclude with some observations and a little one-sided discussion because we're still in the middle of a pandemic. And one final quote from a Michigan PRAMS respondent who tells us that she took a natural as best approach to her pregnancy and is not planning for her infant to receive any immunizations during the first year, but after that he will receive some of the recommended vaccines. And having been on this journey together, we now know that it seems pretty likely that this mom who was planning for her infant to be under-immunized was herself either under-immunized during pregnancy or received neither of the recommended pregnancy vaccines. But we don't know. This is an individual level plan and experience. Just to wrap up and to comment again on the things that we've learned in this time together, we saw that only half of Michigan mothers reported that they themselves had protection with both the seasonal influenza and Tdap vaccines during their most recent pregnancy. About 3 in 10 had coverage with one vaccine, and then about 2 in 10 had coverage by neither vaccine. And then that was again, our exposure or our independent variable, our outcome or dependent variable. Definitely most, 90% of Michigan mothers plan that their infants will receive all recommended vaccines. And remember the caveat, these are plans for infant immunization as reported to us at 3 to 6 months postpartum. And about a tenth of moms plan for their infant to miss at least some recommended vaccines, or perhaps all, and that all subset is 1 in 32 moms. And then after performing some modeling, we definitely see that compared to mothers who were immunized against both influenza and Tdap, our lowest risk group, mothers who were themselves under-immunized and non-immunized are much more likely to plan on raising under-immunized and non-immunized infants. And the multivariate adjustment had very little impact. It could just be this is a truly strong association that will resist anything that we throw at it. It very well could be that there's some competing explanation that we either lack the measurement for, or I have not yet pulled that variable out of PRAMS and thrown it in the model. But at the moment, this looks like a very strong association. So what, Pete? What's the take-home message? What's the importance of this whole exercise? I'm glad you asked that question. Thank you. Because without having a real-world take-home application, then statistics can be, at its worst, it's trivia. We have to think about what to do with this information and what use it could be. And for these findings, things I would take home would be that it would be difficult, I think, for care providers if you're looking at the entire population of expectant mothers each year, and if we had the goal of finding and perhaps reaching out to during pregnancy those who were planning for their infants to be not immunized, then that's a tall order finding this 3% amongst a sea of 100%. However, if we narrow the scope a little bit, if we look amongst the 20% of moms who are neither immunized with seasonal flu nor Tdap, then within this smaller group, 1/5 of moms, we find almost 80% of the mothers who are planning that their infants will receive no immunizations at all. And that's perhaps a little bit more easier group to find and talk to. And the conclusion overall is that the immunization practices of women around the time of pregnancy definitely could be a strong predictor for future plans of infant immunizations. And the reason for reaching out and trying to have discussions with those who have concerns about their infants' immunizations is that pregnancy is a time when people are motivated to make changes that benefit their own health and that of their future baby. And so it seems like a great time to try to reach out and have this discussion. So if you're a prenatal care provider and you happen to see in the clinic an expectant mother who is herself under-immunized for Tdap or for influenza, then if you can find the time, please stop, have a discussion, and talk about her plans for immunizing her baby. That discussion could yield benefits for her own protection if she's willing to be immunized, or if she's willing to listen to reasons why she should consider immunizing her infant. Every research study in the history of the world has had both strengths and limitations. This one is no different. On the left here are a few of the general strengths of PRAMS, and the last two I'll call your attention to. PRAMS knows a whole lot about those who chose not to answer the survey, so that we were able to make some adjustments so that those who did complete the survey are speaking pretty well for others who are very much like them who didn't complete the survey. And then women share a lot of private and sensitive information with the study, and we appreciate that. We appreciate that trust, and we use that to communicate clearly to you their thoughts and plans and experiences. Some definite limitations. Actual infant immunizations may or may not match the plans that mom reported to Michigan PRAMS at the time of the survey. And about 7% answered I don't remember or I don't know to their Tdap status. And then again, the final models are kind of the sum product of the missingness of all the individual pieces. So there's some models where we're probably down to around 7,000, 7,100 respondents. So it's a fact of the study, but there are ways to evaluate the impact of that missingness. And there are definitely potential biases. And with that, we conclude with the acknowledgement slide. Many people pull together and work together every day, every week, every month, every year to collect and bring this data to you. Outside of the Michigan Department of Health and Human Services, the Centers for Disease Control are important partners, and the Rutgers Blaustein Center for Survey Research. But most of all, of course, we wish to thank those who take the time and the effort to share the stories of their pregnancy with the Michigan PRAMS team. We could not do any of this if people were not willing to sit down, complete the survey, and tell us the good, the bad of what was happening around pregnancy. Thank you very much. I will thank you very much for your time and attention and for accompanying me on a talk in what you thought was a poster session. I would love to get in touch if you have any thoughts or comments about this analysis or anything around maternal and child health. Please drop me a line at that email address, and thank you to these 3 authors that demonstrated the safety and efficacy of influenza and Tdap immunizations for moms during pregnancy.